Hello everyone from Male Secret 60 Plus. A warm welcome to our channel, where we talk about men's health, vitality, and well-being. Today, we have a very important and sensitive topic to discuss, inspired by conversations I've had with our dear doctor, Jane Taylor. Today, I want to ask you a direct and deeply personal question. Have you ever imagined that by taking a simple pill for blood pressure, allergies, or even to sleep better, you might be, without realizing it, sabotaging your confidence and performance in intimacy? Dr. Jane Taylor brought this reflection to my attention, and it's something that many men over 60 and even younger need to be aware of. Stay tuned to understand how this happens and what we can do about it. Or perhaps more immediately, fueling that anxiety and frustration that prevents you from feeling fulfilled and virile as you deserve. There's a silent thief of male vitality, a problem that millions of men face in silence, often blaming only age, when the real culprit might be hiding in your medicine cabinet. And the worst part? That medication your doctor prescribed to help with a condition might, on the other hand, be creating an even more delicate issue, affecting your relationships and self-esteem. This condition has a name: Medication-Induced Erectile Dysfunction. And it's far more common than you might think. Studies show that up to 25% of all erectile dysfunction cases are linked to the use of common medications. Think about that. 1 in 4 men might be suffering unnecessarily. But stick with me, because the good news is that knowledge is our greatest weapon. Today, I'll reveal the 5 groups of medications that most affect male performance. And the last one. Oh, the last one will shock you, because it's something millions of people use, thinking it's totally harmless. I'll introduce you to the Performance Risk Scorecard, a secret tool we use to measure the danger of each medication. And most importantly, I'll show you how to apply the SMART Substitution Principle so you can discuss safer alternatives with your doctor. Each medication I'll mention attacks your performance from a different angle. It's crucial to understand how they work. But pay attention. The most critical point, which I'll reveal at the end, is that these risks add up. It's a cumulative effect that your doctor and pharmacist might not have warned you about. Stay until the end to understand. Now tell me in the comments, have you ever suspected that a medication might be affecting you? Where in the United States or the world are you watching me from? I love knowing. Let's get straight to the point. Losing performance isn't an inevitable sentence of age. It's a condition with causes we can identify and manage. For male function to occur perfectly, 3 systems need to work in harmony: adequate blood flow, precise nerve signals, and balanced hormones. The medications we'll discuss today sabotage one or more of these pillars. Let's start our hunt for the hidden villains. Medication number 5. Certain prostate medications. Yes, you heard that right. A medication to help one aspect of men's health can harm another. I'm specifically talking about the class of 5-alpha reductase inhibitors, like finasteride, known under brands like Proscar or Propecia, and dutasteride, known as Avodart. They're effective at reducing prostate size, but they do so by blocking the conversion of testosterone into DHT, a crucial hormone. The result? In some men, a drastic drop in libido and performance quality. They carry a score of 3, the maximum, on our Risk Scorecard. Safe alternative. Talk to your doctor about alpha blockers, like tamsulosin, known as Flomax, which relax the prostate muscles without interfering as much with hormones. Medication number 4, antidepressants and anxiolytics. Now the conversation gets serious. Millions of people rely on these medications. The older ones, like tricyclics, e.g. amitriptyline and clomipramine, and the more common ones today, SSRIs like fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, can have a strong impact. They act on brain neurotransmitters like serotonin, which is essential for mood, but in excess, it can switch off the pleasure centers and nerve signals needed for performance. It's a devastating side effect for many. These medications carry a score of 3, the maximum. Smart alternative. Never stop on your own. Have an open conversation with your doctor. There are alternatives with less impact, like bupropion, Wellbutrin, or mirtazapine, Remeron, which might be better suited for you. Medication number 3, high blood pressure medications. This is one of the biggest culprits, especially 2 classes, thiazide diuretics like hydrochlorothiazide, often abbreviated as HCTZ, and older beta blockers like propranolol, Inderal, and atenolol, Tenormin. They're great for controlling blood pressure, but they can reduce blood flow throughout the body, including to the areas that need it most during intimacy. It's like trying to fill a tire with a leaky hose. They carry a score of 2 to 3 on our scorecard. Smart substitution. There are more modern antihypertensive classes, like ACE inhibitors, e.g. lisinopril, or ARBs, e.g. losartan, known as Cozar, which generally have a much lower impact on performance. This is a conversation worth having with your cardiologist. Medication number 2, muscle relaxants. That back pain, that neck tension, and you take a muscle relaxant for relief. Medications like cyclobenzaprine, sold under the famous brand Flexeril, are extremely popular. The drowsiness they cause is a clear sign of their action on the brain. They block acetylcholine, a vital neurotransmitter not only for muscles, but also for the nerve signals of performance. Chronic use for pain is a silent danger to your memory and performance. It carries a score of 3, the maximum on the risk scale. Safe alternative. For chronic pain, the path is physical therapy, strengthening, and safer painkillers like paracetamol or limited-use anti-inflammatories. Don't mask pain with a sedative that knocks you out completely. And now, the item I promised, the champion, the most dangerous, not because it's the strongest, but because it's the most common, accessible, and underestimated. Medication number 1, allergy and motion sickness medications. I'm talking about diphenhydramine, the active ingredient in the globally famous Benadryl, dimenhydrinate, which you probably know as Dramamine. Yes, these over-the-counter remedies that everyone has in their first aid kit. Everyone thinks they're harmless. But they are powerful anticholinergics with a score of 3, the maximum, that cross the brain's protective barrier with alarming ease. Taking a Dramamine for a trip? Okay, but using Benadryl to help you sleep every night? You're literally giving your body a daily dose of one of the biggest performance saboteurs we know. The critical point? The sum of the risks. Now, the secret few know. You found an antihypertensive with a score of 2 and that muscle relaxant with a score of 3 in your medicine cabinet. Your risk isn't 3. It adds up. Your total risk load is 5 factorial. A study in the Journal of the American Geriatrics Society showed that a cumulative score of 3 or more is strongly associated with cognitive decline and, consequently, performance issues, since the mind and body are intimately linked. The effect multiplies. The smart substitution principle. The solution isn't to stop everything and panic. It's to have an honest, informed conversation with your doctor. Ask, "Doctor, what's my total risk load when adding up my medications? How can we apply the smart substitution principle in my treatment to protect my performance and brain health?" Now that you know what to avoid, the golden question is, what can you do to shield your body and boost your performance naturally? That's exactly what I cover in this video appearing here to the side with the best supplements and vitamins for men's health. If you like this video, show it. Like it, share it to protect the health of those you love. Subscribe to never miss any content. Remember, every day without action is a piece of your confidence you might not recover. The choice is yours. Would you rather invest 5 minutes in knowledge and a conversation with your doctor, or risk years of frustration? The time to act is now. I'm Dr. Jane Taylor, and this is my Male Secret 60 channel, where we care for your health so you can live with fullness and vitality. A kiss, and see you at our next meeting.